The following educational video was created in collaboration with the Faculty of Biomedical Engineering of the Czech Technical University in Prague and the First Surgical Clinic of the General University Hospital. Enema, also called a clister, is the introduction of liquid into the rectum to reach the large intestine. This is done for various purposes, such as removing stool from the large intestine, supporting intestinal peristalsis, administering medication to the intestinal mucosa, the use of contrast agents, or cleansing the intestines before a medical examination, surgical procedure, or childbirth. An enema is performed based on the indication of a doctor. Special attention is paid to the patient's medical history regarding intestinal diseases and surgeries involving the intestines, rectum, or hemorrhoids. Enemas are contraindicated in patients with an acute abdominal condition. Laxative enemas are administered as drip enemas or as microclysters. These enemas are smaller and easier for the patient to retain. The administered fluid breaks down hard stool so that the patient can expel it naturally. For the procedure, the necessary tools should be prepared. A receiving basin, an emitting basin, Vaseline or another lubricant, cotton wool, single-use non-sterile gloves, a protective pad for the patient, and a commercially prepared product for microclysters. After identifying the patient and obtaining their consent, the patient's position is adjusted and they are placed on their side. Put on gloves and place a disposable pad under the patient. Prepare the microclyster product according to the instructions on the package leaflet. Shake it well by hand until foam forms. Break the neck at the seam and apply the petroleum jelly on the tip of the nozzle before inserting it into the rectum. Ask the patient to relax their sphincter and gently push as if having a bowel movement. Squeeze the product and withdraw the nozzle from the rectum to avoid creating a vacuum that could draw the liquid back into the container together with stool. Microclysters can also be administered using a Janet syringe and rectal tubing. The applied liquid does not need to be sterile and should be body temperature. Before inserting, we will adequately lubricate the tube and insert it at least 6 cm into the rectum to reach the ampule. Apply the liquid slowly so that the patient does not feel an urgent need to defecate and expel the substance immediately. Cleansing enema. A cleansing enema is indicated to cleanse the intestines of residual stool and prepare for examinations, childbirth, and certain surgeries of the large intestine. It can be done in the form of a drop enema as well. Prepare the necessary equipment for the procedure. A disposable pad under the patient, an emitting basin, cotton wool, or an infusion supply and set for administering a drip enema, and an irrigation set for filling and administering the liquid. You will also need petroleum jelly or another lubricant to coat the rectal tube, a rectal tube, and a basin, or a mobile toilet chair for patients who can reach the bathroom. The irrigation set is attached to an infusion stand, filled with non-sterile water at body temperature, and flushed with the liquid. The lubricated rectal tube is inserted into the rectum and gases are allowed to escape. Afterward, attach the tube to the irrigator. The set is equipped with a button that regulates the solution flow. A larger amount of liquid is introduced into the rectum in a short time, which leads to a strong urge to defecate and may pose a problem for the patient to retain the fluid in the intestines. The procedure can be temporarily paused, and the patient can take several deep breaths to calm the urge. The liquid should remain in the intestine for at least 10 to 20 minutes after application. The procedure is repeated until clean liquid exits the patient. Drip enema. For the application, use infusion bags warmed to body temperature, infusion sets, and other necessary tools, similar to those used in previous procedures. After identifying the patient and obtaining consent, position the patient on their side. To ensure proper flow, we attach the infusion set, flush it, and hang it on the stand. Lubricate the rectal tube before inserting it into the rectum. We place a disposable pad under the patient. The rectal tubes used for drip enemas are thinner and are fixed to the patient's skin with a strip of adhesive to prevent slipping. The procedure typically lasts about an hour. The liquid is administered slowly into the large intestine, so the patient does not feel an immediate urge to defecate and can more easily retain the liquid. The patient should lie on their side, or if possible, change positions from the left side to their back and then to the right side. This helps the fluid to penetrate deeper into the large intestine. The collection bag is sealed tightly. After the fluid is applied to the colon, it is positioned below the level of the patient. The stool then flows back into the bag by gravitational force. This method is not suitable for hard stools. The procedure is ordered by the doctor and is non-sterile. The applied liquid is at body temperature. The procedure is not painful but can be sensitive. Care should be taken to preserve the patient's privacy. Cleansing enemas clean the intestines. Laxative enemas soften the stool. Therapeutic enemas administer a prescribed medication to the mucosa of the large intestine, and diagnostic enemas introduce a contrast agent into the large intestine. Care should be taken with patients at risk, particularly those with a history of intestinal surgeries.